Hello. The topic I will talk about today is anabolic steroids. What are anabolic steroids? We need to start with testosterone, guys. Testosterone is the most important male hormone, giving men the male body form and reproductive characteristics. So, what are anabolic steroids? Anabolic steroids are synthetic derivatives of testosterone with enhanced anabolic effects. It was introduced for the first time in 1950. It has been used for about 70 years. What are their chemical structures? Testosterone has an A and B ring, as can be seen in the picture. Modifications in the A and B ring are on its anabolic effects, and modifications at the 17th carbon allow it to take its oral and injectable form. So how do we classify testosterone types? Testosterones are generally divided into 4 groups as oral ones, injectable ones, and according to their basic chemical structure, boldenone-like, trenbolone-like, nandrolone-like, and testosterone derivatives. In terms of effect, they are basically divided into 3. Those which have testosterone-like effects, dihydrotestosterone-like effects, these are stanozolol, oxandrolone. They don't turn into estrogen aromatization, so they have low water retention and nandrolone derivative-like effects. Its characteristic is that it has a low androgenic effect, because its metabolites have almost no or very little androgenic effect. That's why it is so popular among them. So how do people use anabolics? The general principle of use of anabolics is to use many substances together at low doses and reduce their side effects by increasing their synergistic effect. The basic approach is, the higher the testosterone, the higher the muscle. Because androgen receptors increase the number of receptors as long as androgen, testosterone enters the body. In other words, it is not like opioids, narcotics, drugs. In order to get the same feeling from drugs, the dose should be increased in the following doses. But androgens have no such effect. Now one does these first for mass accumulation. The period of mass accumulation we call polypharmacy. This period is 4 weeks to 9 months. After this period is over, they use testosterone stimulants, usually clomiphene and HCG, to reawaken and stimulate the testicles, and drugs such as aromatase inhibitors, tamoxifen, and arimidex to eliminate the estrogens that occur. Usually people can do this between 3 to 6 months. But there are also athletes who do this for 52 weeks, that is, all year round. Now let's talk about the harmful effects. That was my purpose in preparing this video. There is a full-scale study done 10 years ago in Los Angeles that was answered by 500 anabolic steroid users. What are the most remarkable things about this study? For one thing, 30% of users are under the age of 24. 60% of users use more than 1,000 milligrams of anabolics per week. This is a high rate, of course. 40% of users use it for 4 years or more. 10% of users have been using anabolics for more than 10 years. What does this mean? If you have been using a product, or a chemical for more than 10 years, you are now addicted to it, or you have experienced an addiction process. Now what are the side effects that 500 users complain about the most? 63% complained that their testicles were getting smaller. This means that testicular shrinkage is clearly present in these athletes. 63% is a very serious rate. 40% of users complained of changes in mental status, changes that they could not control. As I just explained, you feel perfect when you use it for the first time, but later, the person can feel so depressed when these chemicals are withdrawn from the blood, and they can cause sudden and uncontrollable behaviors such as delinquency, violent behaviors, and aggression. 24%, which is a very serious rate, almost 1/4 of users, had erectile dysfunction, and 23% had gynecomastia. I think the most troublesome complaint among them is erectile dysfunction. Because erectile dysfunction is not like others, it is very difficult to treat. There is a way to treat gynecomastia. It can be treated with a small operation. But you can't cure erectile dysfunction easily, because this time you may have to use chemicals like sildenafil or tadalafil. Of course, most of them are chronic users, most of these 500 users, because a quarter of them are using growth hormone. So these are not beginners. They are anabolic users. Now these are the most common complaints, the most common side effects. What are the rare side effects? Sudden cardiac arrest, heart failure due to hypertrophic cardiomyopathy, liver tumors, liver failure, kidney failure and short stature due to the closure of the epiphyseal plates at the ends of the bones if the athlete started the product or chemical early. These are rare side effects. Another striking study among powerlifters was carried out in Finland. After 12 years of follow-up, the results emerged. It has been determined that the risk of death between powerlifters using anabolics and non-users is 4.6 times, that is, the risk of death of powerlifters using anabolics is 4.6 higher than those who do not use anabolics. This is a very serious and important study, I think, about those who use anabolics. Here are my conclusions from a very large-scale literature review on infertility. In one study, it says, when the sperms of the patients who were administered 200 mg of testosterone weekly were examined after 12 weeks, it was determined that half of the athletes had azoospermia, that is, zero sperm in the ejaculate, and oligospermia, that is, below the normal sperm count in the other half. So just injecting 200 mg of testosterone weekly makes you completely infertile after 12 weeks. However, almost all of these athletes recovered their sperm quality within 4 to 24 months. All of them recovered completely without any PCT or HCG, without using clomiphene. So, is there anyone who is permanently infertile among these cases? The cases with permanent infertility are as follows. Patients who have used steroids for years, quit and still have azoospermia after 3 to 5 years have been identified in the literature. Even they were treated with FSH analogs, which we call HCG or HMG. There is also something like this, many people do not check their sperm count before using anabolics. We don't know if it's bad from the beginning because they don't check their sperm count. Therefore, we can say that there is no study in the literature that anabolics cause permanent infertility. There's also the fact that sperm quality has deteriorated drastically in men over the last 50 years. Environmental factors, industrial chemicals, heavy metals are now deeply embedded in our lives. So we cannot directly blame anabolics. Well friends, anabolics are like this. We also talked about infertility. People know anabolics, so they know that anabolics are harmful. Why do they use them? Everyone knows this on the internet. One of the most common reasons for chronic users not to quit, when asked to patients, is that they build a social circle with their muscle mass, build a circle of friends, self-confidence, gain prestige or reputation in that circle with those muscles. And people know that they will shrink when they do not use anabolics. He does not want to show his friends in the salon that he is getting smaller. He thinks that he will be humiliated, and many of the chronic users cannot quit because of this. What I call chronic users, I define users over at least 10 years as chronic users. Of course, what I said applies to abroad. Because these products are not cheap products, in fact, they are expensive products, and it was determined that 20% of these products were fake in studies conducted abroad 10 years ago. Oral anabolic steroids have even been detected in oral supplements, namely protein powders and amino acid powders. In other words, when taking protein supplements, amino acid supplements, be aware that there may be an oral anabolic steroid in them. You can understand it from this. If it suppresses your LH level, it means the amino acid supplement you are using has a problem with it. In my personal experience, there was a case of infertility. That case was fine, there was no problem with it. There was a case of erectile dysfunction, that case was troublesome, problematic. Also, I had 1% case, post-cycle therapy. This is what happened there. With just 1 dose of Primobolan and 1 dose of Sustanon, we saw an increase in free testosterone from 8 to over 200 within 48 hours. So free testosterone had increased 25 times in 48 hours. Of course, this first wave hits high, then drops off and continues that way for a long time. In other words, it increased the hormone in your body 25 times, and to produce it in a natural state under normal conditions, you would have to have a kilogram of testicles. This, of course, is not possible. Of course, when it increases 25 times, everything is super, the weights increase, the training is done well. Then we looked again at the end of the first month. We saw that the free testosterone dropped to 3, so from 8 to 3. We gave 20,000 units of HCG for recovery. But unfortunately, even though we gave that, after 1 month, we found the free testosterone level to be 3 again. These are very simple things, isolated cases. But I want to tell you this. Testicular stimulation with PCT isn't always that useful, guys. For example, we didn't give FSH to a patient, we didn't give HMG, the patient recovered on his own. In other words, the reason we went into the case is that most patients recover on their own. But the thing that upset me the most was seeing young people in the gym taking testosterone at the age of 16 just because they were 40 pounds overweight. In fact, with a good intense cardio program and diet, you can easily lose 40 pounds in 3 months. On top of that, he can improve his body as well, but instead they give him testosterone and of course he loses weight in an easier way, but 3 to 6 months later he regains the weight. In other words, it does nothing for the child, it actually brings a short-term gain. After all, a 16-year-old would probably grow taller. If you give testosterone, you close the epiphyseal plates, maybe the child will grow 2 to 3 centimeters longer, but he will remain shorter. Anyway, guys, in conclusion, I'm glad I was able to answer some of your questions. If you have any questions, I can answer them in the comments section. Thank you very much.